I'm Maura Carley, founder and president of Healthcare Navigation, and today I want to talk to you about Cobra. Cobra is a very important protection, but also commonly misunderstood. So we're going to do at least 2 videos about Cobra, but remember, these are short videos about complex topics. If you need to learn more about Cobra, please do additional research, because these videos, although we hope that they are helpful and informative, cannot be comprehensive. So what does Cobra stand for? It's a mouthful. It stands for Consolidated Omnibus Budget Reconciliation Act of 1985. So let's focus on the environment in 1985 for a minute. Most people had good group coverage through their work, and then a much smaller proportion of the population that wasn't tied to coverage through a job had individual coverage, and that coverage tended to be medically underwritten, meaning you could be denied. And so you had to be pretty healthy to get that individual coverage. So what happened for the person who lost their job or wanted to leave their job, or God forbid, a spouse passed away or a marriage ended in divorce? Then the worker and or the dependents in all those situations could be left without coverage because they may not be able to pass medical underwriting due to their health conditions. So that was the purpose of Cobra, to provide all these people, workers who had good group coverage through a job, and their dependents, a temporary safety net that could get them to a new situation, hopefully good group coverage through another employer. But I think everyone should understand the origins of Cobra when you're thinking about who it doesn't apply to, which we'll talk about later. Remember, it's the temporary extension of group coverage at the individual's expense, unless, of course, the employer decided to subsidize it for some period of time. So Cobra's federal legislation, it applies to employers of 20 or more employees. So let's talk about that, because there's a state version of this as well. The length of time under federal Cobra legislation for a maximum Cobra period is 18 months for the worker, 36 months for the dependent, and if you were on Social Security, disability, transitioning to Medicare, 29 months. And there could be an extension of Cobra. Let's say the worker left a job, and so the whole family has 18 months of Cobra, but then the marriage ends in divorce. Then the dependents who were affected by the divorce have a possible extension of Cobra coverage to 36 months, a total of 36 months. But I don't want to get lost in all the details. The important thing to remember is that is under federal law. If you work for an employer of under 20, you are eligible for the rights under what's typically referred to as mini Cobra. And the states vary tremendously. Some have Cobra periods which are shorter, and they can be much shorter, and some have more generous. New York, for example, even if you are more than 20 employees, but regulated by the state of New York, meaning the New York State Insurance Department, which is called something else, which escapes me, but it's regulated by the state insurance department. All workers have up to 36 months rather than the 18. So you need to understand what you're entitled to. and how that works with the individual market as well. Remember, Cobra has nothing to do with individual coverage. It is the temporary extension of group coverage. So you're an appendage to the group. If the group goes out of business and there's no plan, then your Cobra ends. There's no policy to be attached to in that instance. And similarly, think about Medicare. If you're eligible for Medicare, there was no reason for the government to require employers to continue to offer Cobra. So if you're on Cobra and become Medicare eligible at age 65, your Cobra should end. It's even more complicated for people who work beyond age 65. They are supposed to be on parts A and B before they elect Cobra. But we're getting into too great a level of detail. So I think we should end there. I hope you understand Cobra a little better. It's an important protection, although it adds to the complexity of things because sometimes people can have several choices about their coverage. So thank you for listening today. Please spread the word about these videos so we get more people, if not excited, interested in learning more about their coverage. And thank you for listening. We hope to see you soon. Take care.